Straight.
Okay. No, the second.
Otherwise, Dr. Farber said you're gonna sitting too long, then you're gonna get numb, right?
Maybe create another question. No, Dr. Kleyn. To the presentation.
So,
We do not finish.
I'm
We just beginning.
I'm just gonna add to what Dr. Farber mentioned that we never question you for questions. We never. There's no stupid questions. There's not answered. So any questions are always welcome because that's the way we coming up to make decision or making solutions. Otherwise, even in our companies, we have I would say strongest scientists. What we have are some of them has 2 PhDs, some of them have 3 PhDs. It's just PhD, just general terminology, but in reality, it's involves years of learning. We have scientists who are PhD in computer science, his PhD in microbiology, in pathology, and pharmacist, pharmaceutically graduated. It's not just a word. It's a love. It's a passion. That's what we're talking about today. Some people say it's too early to choose. It's never early, never late. Let's put it this way. It's always opportunity. They're always. It's all about your willingness, what you would like to do, and what you would be eager doing it and happy doing it. People say sometimes we come to places, and they say thank you for your great knowledge and work. He said no, it's my job. I feel like if you want to say that it's your job in your future career, you want to say that's my passion. That's what I like doing it. Job is something, you're forced doing it. That's what am I feeling when you say that. But of course, we have to work to, for certain monetary reward, and this. Okay. But in altogether, we just want to just from this today's meeting, just take home message. Whatever you do in your time being or what you're planning to. Those opportunities, you just have to look for it. If you don't, it doesn't come to you. It doesn't fall to your hands. Yeah, let's do it, Shana. Okay. Look at you, go from there. Lights off. Then we're gonna go to the dream again. So mine will be shorter because Dr. Farber covered like tremendous. Thank Dr. Farber. So it's easier for me to get over the presentation. But overall, it's about our company. So it's a nodule, that's what they call it. Anybody knows, I guess, I mentioned yesterday someone what this nodule stands for. Nodule, certain time you're coming up with the names, and when you open the company, people think about different names. Apollo you mentioned, and different names, right? Like Modern Medical I called it, and so on. So there's always some meaning behind it. Anybody want to guess what the nodule stands for, or? Unless somebody heard what I said yesterday.
Anybody in Hebrew?
Hebrew?
Nobody?
So that's nodule. So for discovery, let's try to, when we do dementia, I'm also internal medicine and geriatrics specialist. One of the tests in dementia, we have to spell words backwards. That's why I mentioned dementia. And one of the words that's a world, we tell the patient spelled backwards. And this is the DLOWRW. So you want for this scenario, I'm gonna use the same pattern, spelled backwards. Legion? Legion. Where does legion word comes from? Rome. That's correct.
Yes.
That's from the Rome.
It's
a Roman, and it's not just Rome. It's fighters, Roman fighters called legions, and they have a special way to conquer, and that's what they won practically the entire world coming to. As they called chiripaca, that's what they call turtle style. They have it. They put all these sheets to cover from the arrows. There was the idea. That's what the legion, one of the technique they have. So that's what we come up to the point, and plus we work as a team. What we like about being legion part, anything you could win, you cannot be just one. It has to be teamwork. regarding, always they say that from the school, it's always say that, right? Not just because you guys want to get friendly, not to interact together, but there's a very strong point behind it. And it's going to be helpful with your life and career. So that's we're Legion Nodule.
No, Dr. Kleyn, I want to add one thing.
Yes, absolutely.
Make this analogy perfect. So was idea when you created dynamic drugs, our molecules of dynamic drugs, like these soldiers of this legion, they fight together with enemy. And this was idea, these our molecules, they fight all this, whatever we have, right?
Right. Any problems that we face we get together to solve the problem. So we are a startup company in New York, but we're not a startup as in the science. We have behind many years of scientists that we have and research done. And the company's expertise is synergistic combination, synergy. When we get together, we can, same log, I can lift it myself, but we can get together and solve this problem and clean up, so to resolve problem together. That's synergistic, especially if you succeed. So that's the synergy. Plus you have to combine people together, combine drugs together, combine certain things, and that's what we are very strong in, this synergistic combination. And we're coming with new pattern or new use for that medication. That's called generic. Generic meaning something already been on public and they have already lose their patents, so it could be used for, anybody can use those drugs for certain purpose, but when you combine them, suddenly you realize it has a new features to it. And as Dr. Farber mentioned too, we also have a unique worldwide, no one else, it's called dynamic drugs. And it's already patented, United States patent, Eurasia patent, and this is really startup for today as we're gonna move on with that project as well. Coming to the next point, that's our, just as Dr. Farber said, it's short team who you can see, but behind the scene you have a really large, powerful team. It's not large, at times people think bigger company is stronger, not necessarily. The strongest comes what they do and how they stronger in the knowledge and functionality and how the team works, rather than amount of people. Otherwise, too much people can pull the same log to different directions. So you want to have it something, only you can see team, it's just tip of the iceberg who's around in the United States, but so many other scientists, brilliant scientists, who not written here. Next. And trees, Dr. Farber tremendously mentioned about the trees. Now you guys look it up, and you're gonna be one of those who will know what this trees is. And not just by knowing it, and it's one of the tools that you can utilize in your career. And this is actually Samsung and General Motors, NASA that mentioned, but there's a huge list. We had one of our presentations there. And we are only the company who utilize that trees, because mainly trees utilized in technology, in computer science, mainly in those type of areas, but not pharmaceutical. We're the first who start using trees in that direction, and that's why we have tremendous success so far. Al Schuler is the father of the trees, and it's already well known. You go, even though those website, a previous slide what I had, it's, if you go to website Samsung, it says it's Soviet Union, and that's the trees, and it helps us to come up with a battery, which is stronger battery from there right now, but anyhow, that's because the expert from the trees, they help them out to do that, to solve this problem. Next. Coming to our reality show, our health, differently. People sometimes, we see patients, customers comes and you thinking how much they spend buying clothes. We do the same thing. It's our routine life, going to the shopping, and so sometimes we don't realize how little we spend for our health at the end of the day. So priority, very interesting. So in human nature, but in reality, you can easily lose your health than you can gain. So that's why, and something which is, if you choose, pick up anybody who ever took any pills, supplements, vitamins, everybody have been involved in that scenario. It means it's so important in our life as well, as a maintaining health and then also support and get better. So that's why we definitely would like to be. We chose that field out of all the topics we ever had. Plus, it's not just a field which you go by the tunnel or you go by. It's not even ocean. It's really space. What we're talking about right now. You could go so many directions in this field. And this is like generic repurposing drugs, meaning something would exist, we just repurpose them for different reason. And what you see here, all of them has a patents already. And the great news for us today, we just got for the last 2 years, we got US patents, hardest patents to get ever. So we got them. So it gives us really stronger next levels what we're going to implement. And dynamic, finally we can talk about it because we got patents too. So dynamic drugs, this is novel drugs, and we're going to briefly talk, because Dr. Farber greatly touched base on each of those topics, so I want to give you idea, not about medicine, about what could be done, what the opportunities are, and where the chances you guys can participate if you wish. It's all on your wishes, what we'd like to know after this presentation. So this repurposing, we have a few projects, and I didn't draw this. That's pictures, that's the photos, that's all from CDC. Who knows what CDC stands for? Central Disease Control. Central Disease Control. What that means, any disease, not even in the United States, worldwide, they report to them. And this is what multi-drug, MDR stands multi-drug resistant. It's a little blurry. You guys okay? You can see? Yeah. Okay. So, and I just took few because we're gonna take like 5-6 slides of what they're trying to say. The idea behind it, as one more time, it's nice that Dr. Farber prepared. I don't have to repeat dynamic word again. So bacteria, as any nature, are dynamic, moving, changing, and called mutation. That's the word they use. And who would like, if I hit you all the time, would you like that feeling? No. You're gonna change, you're gonna move, you're gonna hide, right? So same thing with bacteria. You hit them with antibiotics, they say next generation comes up with smarter or more adjustable way, but but any medication you take nowadays, they are static, meaning it's solid formula, and it only was created for a specific area, as Dr. Farber mentioned about glove and the ball, right? So when it comes, you think, oh, gonna work now, and it's already changed. It's slippage effect, it passes by. It touches, gonna have some effect, but it's not gonna work the way it was created. So they become resistant, meaning we call them resistant. They're not resist, but they do also. They cover the shed. It's called special virulent factors. They creating toxins. That's what people feel, down and sick, so that nature. And that's what we've seen already. We're chasing bacteria running from us. We're creating new antibiotics. And next, it's $35 billion. It's not going to be worse than $35 billion we'll lose by fighting with them. So much money involved to survive. And that's why we come up with the idea how can we help with this problem. I didn't put that slide. We have scientific presentation, something simpler. One slide we have amount of antibiotics when it was created in 40s was just 2 penicillin first, and then we got a bunch of like 5, 6, and we have a table goes up and up, and around 70s, 80s suddenly those tables goes down. Why suddenly? It's bacteria got smarter, got mutation, and newer antibiotics what already created, they do work against them, but they're static, and bacteria even smarter, they're changing configuration faster than we expected. So there's not much antibiotics are available to utilize because of cost again. A lot of cost involved in pharmaceutical. And we came up with trees and the group of nodule. So everybody wants to hit the antibiotic, chase them, getting angrier. Let's look at a reality show. Let's see how the bacteria leaves. The bacteria, you go back, that's the point here. at times in our lifetime, even something we would like to resolve, we're rushing over. Let's see what is up front. If the problem doesn't happen, we cannot solve it. Sometimes people say, even your parents say, hey, relax, back up. Just take it easy. Reset. Go back and see. Go back to what you're, even solving math or physics, you go back from the start. Maybe somewhere you missed the point. So this is the point here. It's one of the tables we have here. We said, wait a minute, everybody wants to hit them and so that nature. It's 2004, one of the tables with two. We said, wait a minute, let's see another bacteria, how they function, what's going on. So basically, relax, get back, meaning just look it up at the same problem from the top. Don't look from your perspective what you want to do. See from the enemy perspective what they do, how they function. And going from their side, figure out how you can function, how you can work with them, or how you can succeed what you would like to do. So we looked at it like this. How does a bacteria function? They have a lag phase, LAG. They have a log phase, or logarithmic growth. Then you have a plateau, due to cell function and death. This is nature law of the nature. We cannot change it. But what we could do to find out what they do, what does bacteria do in this part, that's sort of enemies. What they do in this part. So we knew, everybody knows fact, but we found out solution for it. So in this stage right here and here, those two here, bacteria just start growing and they fight with each other and they creating virulence factors right here. Whatever they are, they have a share, they have spikes, they have toxins release in this area. Coming to this area when the winner goes further and they grow so tremendously and there's prosperity, everything beautiful, shiny, no fight. They're taking the clothes off, they're taking a sun bath and tatting and all this about, and they're taking off their protections, and then we figured out that's the spot you hit with our vehicle. Now, and then what Nogel came up with solution, this is the one Dr. Farber showed to you, and it's proved actually years back, that's what they face when they grow in the log phase, that's when toxins dropping. It's known. Now what do we do? And again, how we come up with solution, you see this number one. It's not helping you, taking your hand to help you. Definitely behind it, knowledge of the trees, methodology, approach, different scientists who are also trained in the trees. And Nogel discovered the key, and again in the log phase, and it's not as simple even to analyze. Look at those drugs we used, 38,000. It's not like piece by piece you do. That's what we came up with, mathematical modeling, which is actually, it's our creation, the companies. It's not worldwide known. There's a special program that we created. Again, without our knowledge of science, you have to know what medications put together, right, to analyze them if they're gonna help us out. The idea was how to put, let me tell you what come up to, how to put those bacteria who are not in the log phase and tell them go to the log phase, and they'll come after you. So that was the idea, simpler way to tell you. And discovery, we call that NGL 025. That's the combination of different drugs, medications existing. Like I just give you example, Tylenol, aspirin is known, right? They're on the shelves. So we use those who are existing. We live in those drugs, but you have to have a tremendous knowledge and science, know which one you can combine together. Almost same like you cook your food at home. So, and we use that groups here that's for synergistic combination, not just combine, make sure they get together, they work together, and they don't hurt each other, and then don't hurt the host body, the human. So not that simple as it sounds, but it's worked. Teamwork. Dr. Farber briefly mentioned about it. So Petri dishes, you start from, basic. It's like, if you guys didn't see the Petri dishes, that's what the Petri dishes, we call it, plastic container. We put those two antibiotics, which are actually these bacteria, are resistant to everything possible right now. They're like, it's called multi-drugs or extra drug resistant. And here we don't add our product. Here we do. And 6 days later, we already see an area where it's already destruction, growth, destructing bacteria. They start dying it. Next, we adding more. We tell them, hey, have more fun. Like we're giving them more potentiators, adding, but it's not, I just give you a simpler way, but it's actually, you're taking the sample, you're putting another petri dish, it's a process. And it's 9-day growth, third passage, meaning already 3 passages went through. And we see under our involvement, it's more bacteria getting, I would easier to use fooled around. Kind of we give them this ability to get in that lock phase, and those antibiotics which didn't work at all, old antibiotics, whatever already put on the shelf, and they're non-functional, we revive them back to life. That's our goal, because there's not much opportunities we have nowadays. There's new antibiotic getting, bacteria getting smarter than too. And we came up with another point, even those antibiotics which already created, we can make them less resistant as well through this approach. And here we have on day 12, recovery, bacteria is destroyed, and then the immune system is going to take over. But this is just in vitro study, meaning not on the live person, or it's just at the petri dishes. But this is hypothesis went to the proof of concept. I'm sorry to tell it, the previous was Acinetobacter, this is Pseudomonas. So we played same scenario because this is called gram negative. There's a gram negative, gram positive, so we use those gram negatives here, bacteria. And this is another super resistant the bacteria, same antibiotics what they're resistant to, and look at these destructions area, 25 millimeter for polymyxin, and a case in 10 millimeter diameter. And here's nothing going on. 5. They still work, as I said, slippage effect. You're still going to touch, but not going too much work. So, and this is just to show how it's a different way to prove that medium with NGL25, it just destruction, zone of destruction goes faster. Just simpler to observe. This little table we have without NGL, look at those numbers, 5, 6, meaning there are passages, they're still going to do some effect on those bacteria. But next table, for example, right, when you see, we can look at these numbers here, 25, 30, 35, much wider range destruction made by our potentiator, having potentiator with antibiotic. Next. And this is another pattern for another bacteria. That's one. Marker is for 24 hours, incubation period, again potentiators and control medium. With potentiator, the red one, 24 hours destruction, obvious, going really tremendous. And this is the list of those happy campers which are really going to be destroyed, and they are. And this is we're going after. so basically, it's really, I put it down, some in vitro study in 2020, as realized we didn't stop anyway, we stopped for what's the quarter of the presentation we had in 2019. And 2020 when the COVID started, that's we have, as of today, I have to update the slides, we have a bigger list here right now than we had it before by 2020. So as nature doesn't stop to change, we have to move on. Not the picture you had, the doctor behind the bacteria, we should stay. Bacteria should be changed with that physicians nowadays. Great news, as I mentioned, remember, this is European patent and US patent, I forgot to put it in. Because European we got, it's Eurasia actually, not European, Eurasia. It's quite a tremendous area covered, and this is a publication behind it, our presentation here. Next. Polymyxin, it's one of the, remember those multi-drug resistant, we had polymyxin there, right, polymyxin? So it's back again. This is actually last resort, NIH, as again, it wasn't me who said that. NIH. Which is NIH stands for?
National Institute of Health.
Beautiful. So,
Yes.
that's right. See? So, National Institute of Health. It's a national. And they said, this is last resort. Sound really scary. Then what? So, why is last resort? What happened? Well, look at this, 1947, right after World War II. That's what the penicillin came out, then polymyxin. And they use it, it worked great for those gram-negative bacteria, and they stopped. I mean, they stopped, put on the side, because nephrotoxicity, meaning kidneys, nephro stands for the Greek word for the kidneys, they're very toxic to the kidneys. What's happened? So you don't want to be, as we call the treatment, to be worse than disease. So you don't want to kill a person with bacteria, you're going to say, okay, I'll win the case. And you want to really help the person, not to hurt him. And it was on the side, but since those antibiotics don't work as much or don't work at all, and XDR, remember XDR we mentioned, extremely, there's an MDR, there's so many other names came out, multi-drug, or but there's extremely drug resistant, it's beyond than multi-drug, meaning nothing can touch them, they're just like a king of kings. And polymyxin works on that. Even polymyxin getting resistant too, as you saw in my previous slide, right? That's not the scary part, that's what I said. I guess we should put polymyxin first next time. So anyhow, but this is a tremendous decision we made here, which gives us another next level opportunity where we're going to be next. Let me show what we come up to. Remember we said nephrotoxicity, kidneys problem, we said about strong, pros, good stuff, strong antibiotic, it has a very powerful effect on bacteria, it works on multi-drug resistance, and cons, it's nephrotoxicity. Why? Because there's a receptor, naturally we have a megalin, has a good job for our kidneys and works for us pretty decently. But unfortunately the formula of the polymyxin, remember where it's static? Yes? It has a formula, but goes after bacteria, but also, not somehow, also that formula, it's attached to the megalin. That's the receptors on the kidney. And not just attached, it's affinity. The affinity meaning attraction to the kidneys, and it's really problem for the kidney to function from that point. As the other some part of polymyxin running after bacteria, the other one destroying kidney, unfortunately, which it has to release that big product, and that's a problem. And this is one more diagram. Oh, this is how we come up with it. Remember there's another called docking design. Glove. Remember the glove? We had the glove and the receptors. So we start studying how can we come up with the product which can get to that megalin, seal it, and then give polymyxin antibiotic, and polymyxin will come and say, excuse me, place is taken. So go do your job, sort of this way, right? But it has to be powerful, has affinity, stronger heat there, has to sit there on megalin and not to hurt the kidneys, and same time have to be dissolved when problem is over. It's a very complicated problem, and let's see what we did. And we use our technology for the great team and utilize thousands of generic existing drugs. When you're combining them, you're coming up with composition, or you can use that, or new actually medication. So it consists of different drugs you put together, and which you could inject intravenously to the vein, and it has no side effects to the body, has very high attractivity to that megalin, much stronger than polymyxin does. So even polymyxin come and knock the door, you're not gonna say no. You're gonna take it really strong, and also our product has minimum side effects for the body, not to have any influence to us. So, and anything done, it's nothing new for you guys. It's done on the animal studies. Click again, see if it'll come up. Or did it? Somehow it didn't show up, right? Yeah. It's okay, we just mix it again. It's okay. So, it's done on animal studies, it should be coming up here, it's okay. The table. So, we did experiments, you have to take, animals, we took 250 rats. It's quite the amount. When you start, it's not just proof of concept, you have to really find the solution. 250 rats, we studied them for 18 months. 18 period takes you realize not just year, it takes years to study, to analyze. And believe it or not, it's not just I'm telling you, it's a lot of time. It's called trial and error. A lot of companies could work for certain levels and for years, and that probably didn't work. And it's very common scenario here. So thank God we have that the program and team involved, that we had great results here. And what we studied, that we injected our product, we injected colistin. Colistin it's a form of polymyxin. It's just one of these, it's another medication, but it's similar like polymyxin. And then we got the reports here, and we studied, it's called markers, biomarkers. When they urinate, the rats, the peas, we check the markers for toxicity. Because why? Because it urinates from kidneys function, right? So the markers, you can see if it's acute problem, meaning just damaged kidney now, or plus you want to see damage in kidneys like in 1 month, in 2 months, is there leftovers? So that's what they call it, one of the different GAL and NAG. And by testing it out, we found out that excretion level of those toxins, when we have for just polymyxin only, certain rats was just on the antibiotic, as I mentioned, right? There was tremendous amount of toxins. Somebody who gets polymyxin with protection, with our nephroprotectors, damage was minimal, still was there, but it got better as you treat the animal. So it wasn't that, you see how it goes. This is blue on the beginning and the red on long term. So it's the tremendous difference. This is just example. If you come from animal base, we have to come to the human study, human studies or proof of concept we call. And the fact is generic, whatever I just mentioned to you going to be generic. It means we can extrapolate our findings much faster to the humans studies, much shorter than novel or new drugs, because it has different pattern in the FDA, because those existing drugs, and they're already known, and you could just prove that there's no toxicity. You could use for a longer time if you use, some people come with gangrene or infection in the food. Those bacteria, they need months therapies, and you don't want to kill the person, but you want to go after bacteria. And that's a perfect example. You use nephroprotectors, and you utilize the drug, and you succeed. Even could be short, not could be, it's definitely, it should be shorter therapy, because you don't have to fight with the side effects. And you can use full dose. And just to tell it to you from the clinical perspective. Next. Now we got patents, you see? United States patents, we got Eurasian patents. It's time to move on with this project. Next. And how we're coming with this project, as you're listening, what I would say, team, what could be involvement for students or physician coming in that type of project? If you guys done everything, what you need, what you get involved with? There's a lot of tremendous involved with, because when you're applying for different places, different solutions, you have to have people involved, codes and that nature, and you participate in those type of studies. There's always space for anyone to participate. Is next level, that's what we're planning to do. And that's what give you all kind of experience. As I mentioned on the beginning, it's not what comes to you, what you trying to take it or participate in. Diabetic food, pressure ulcers, and other problems. It's one of those composition we have, regeneration. Remember Dr.Farber mentioned stem cells? Just right briefly. So that's what we have here. It's so many hospitalization going on for those natures. 11 billion, no joke, right? Billion, not even millions. Billions are wasted, spent. It's a lot of, it's beside the money, how much people go through the suffering and You cannot, because you cannot count with billions of those issues. And pains people have with ulcers, skin problems, which don't heal at all. Amputees end up become disabled, and so on and so on. And next, what I just give you the issues. It's called unmet need, what's going on, and what we do about it. And we decided we have to come up with composition, what could help with that matter. Not just decided, it was one of the projects we were doing it, and as you're doing science, you find out at times when you use for certain reason, you found out one of the component suddenly make the healing skin better than we tried for something else. I'll show it to you later. And then what came up idea, take that product and combine with others products, and we came to the next level. As I said, pharmacy and medicine, it's a space in reality. So one goes after another, because body is not just one tool, it's so much connected. So coming back to this project here and discovery what we had, we came up with combination generic drugs again, and Dr. Farber mentioned that we have a dormant, we call it latent cells. They're dormant as we age, they become less and less active. And nothing better in doctor or who will produce than your own body. Your own body much smarter than anything you inject from outside. Plus, nowadays the more expensive approach they do use stem cells. They do absolutely. They're looking toward that direction, but they have to draw your bloods. They have to centrifuge. They have to go to the sterility. A lot of process, very costly. That's why they cannot use in public. But this one, we came up with a solution like when you apply to your own body, you wake up your own cells, and nothing smarter than your own cells, autologous, your own stem cells. And that's what others like the Dr. Farber had it. That's what nowadays they do. You have to pull the blood. It's simple here, but it's a process. It takes a few days at times, and it works. Sometimes doesn't, and that's where it could be applied. As a matter of fact, science looking right now to apply this approach, the stem cells in general, and make it better. Not rejuvenation part, we're talking about to improve joints, heart, cardiovascular, in medicine, or even they use for cancer cell. Even in cancer, they use the stem cell too. So it's a lot of tremendous benefits with this project could be applied to. And again, we come up with discovery. This is standard kind of, table we have, but it has tremendous time and effort involved to come up with this solution. And we have this in vivo, meaning tested on animals as well. So this is a product we call Dipazole. We didn't call it gel or something because it's already official. We could call it Dipazole. It's a liquid form. We try to make now cream form. We have a different gel form, but liquid. It has activating angiogenesis, meaning it applies. We found out it stimulates your circulation, improve your circulation, capillaries and growth, and inhibits your process of thrombosis, meaning prevents from clots formation. Analgesic. We use an animal, of course, but we had some volunteers too. I can show it to you later. Which we use for the wound, like end stage, which they use all kind of therapies, and the pain what they had is improved dramatically, and also accelerates healing. We had also for burns, third stage. There's a stages of the burns, right? When you get redness, blister, then deeper tissues, and when you get the deeper and necrosis, meaning damage in the skin to be just dead, and very tough to treat those areas. It's worked pretty nicely. It's just quick graph here for the stem cells, just quick. Without our composition, you have, pay attention on the numbers here, right? 10, 20, and this is it goes 75% more CD3 immune cell reaction, just testing out how the product works. And this is like example of different, this is a wound, you would think like small, we see those type, in clinical work, we see those type of people come to us, patients. And it's a little hole like this, right? You think, okay, big deal. It goes so deep at times, unpredictable and very tough to treat, because why there's a, Dr. Farber mentioned about vessels involved, circulations, diabetes or other disease, comorbidities, so many factors. And it's a painful, and you get, this is one of the burns, this is even surgical. We came up with even, we're talking about disease, but even regular surgical wounds, when you do the, surgery happens or they have to repair something like a knee replacement or some of the surgical involved, we can use we use that aerosol, we could use that, and we did on normal animals, and we did created wounds at times. We have to test it out, and the healing was faster 3 to 4 times than without our liquid. Next here. And this is just quick show the example. For proof where we're standing, we tested out with different products, like lidocaine, lidocaine for pain, right? They use. So our product works faster and longer compared to lidocaine. Lidocaine only numbs the place, but we don't numb the place. Product works the way it makes it healthier, improve the circulation, and it brings the more blood flow, and it stays longer beyond 12 hours, because lidocaine stays for a while, duration effect, similar, but it doesn't do what product does. It was similar with the lidocaine close to, but you cannot compare it because it does much more functionality for the leg. Not for just the leg, but in general for the wounds and any issues. This is just how we studied composition for regeneration. Remember that we're trying to recover this area not just by changing something. There's no physical involved. It's just your own body recovers. And we use composition 1, composition 2, meaning different mixed different components. And insulin, they use for, what do you use insulin for? Diabetes, right? So one of the insulin has a tremendous growth effect on your body. It does. Some people use insulin, they even gain weight for a reason, because it's start building up fat tissue, that nature. And even compared with the insulin, our reparation was much faster, and strength the scars, meaning the scar and the tricuspid strength was healing really strong, the tissue itself. So this is just practical indication that I showed on the picture, right? What could be used for, and even more than you can have in the list here. For neuropathy, nerves involved, damage. This is just, patents also we have in the United States and Eurasia. Patents. US, we just received it. So this is GemoStop that Dr. Farber mentioned to you. It's actually, that's only the device we have. They call it device because it's a powder form. Not just that, because it's not injectable, it's not drugs involved, it's different materials to use for it. And this is from military times, 90% death. Why we talk about soldiers? Because they are away from hospitals, right? From the medical approach. And a lot of, if they cannot reach the medical facility, and because of bleeding, death happens. So, what do we have nowadays? United States Army, next, it's $1 billion they lose. And, interesting what they use from. Nowadays, all the products, existing products, currently, they use from this type of non-absorbable granules, and they based on chitosan. You guys know where chitosan come from? Chitosan. Heating. No? Okay. Chitin, right? Or what? Seafood? Anybody? Shrimps?
Yeah.
What the cover they have?
Like a shrimp.
You know what do you call that cover? Heating. It's based on
Oh,
that.
that's what's,
The
okay.
exoskeleton of the
Skeleton,
Yes,
that's right. Yeah.
Exoskeleton.
So that's heating. Actually, that's what it's made from. So apparently, they didn't took the shell and they grind it, but they actually did do. There's a special process doing through. And they found out apparently with ketosand product was not absorbable granules. And then what they used nowadays, one of the ingredients they use nowadays to stop the bleed from those shell-based that chemical. And it's great product, it stops bleed, excellent. The problem with it, it's not absorbable, it's not bio-friendly, it causes allergies at times, some people, unpredictable, you don't know who does, right? And if you're allergic to seafood, you could say that, but at times, it's you eating the meat, not the heat in itself, right? And it's unpredictable, you put in the powder in the human body, it could cause allergy, it's unpredictable. Or it could cause burn even, and it causes tissue. And the last problem, after you use it, make sure you yank it out because it becomes hard as a rock, it stops the bleed, does the job, but 3-4 hours later, you have to wash it out. Otherwise it becomes solid against the wound, causing the problem, blocking the functionality of the area. And that's another issue with soldiers to get into or somebody in danger somewhere or have disastrous place. It's not practical, but that's all we have right now. Next, where are we coming from? So hypothesis, anything you come idea, become hypothesis. So we decided we have to do what? We have to come up with product which works fast and faster than existing. We have that. It has to be body friendly, and it has to be used smaller amount, but do the job that when you use a bigger amount. You put 10 milligram versus 50 milligram. It has to work as a 50 milligram. You follow it right now, right? This point. That's our goal to give to the scientists our plan to do. And new hemostat has to be not rejected by the body friendly, and should be after we use. We don't want to. After you pushing this out, it's going to damage another tissues. It has to go somewhere, right? So we come up with a solution that has to be biodegradable. That was a plan. And here we come. So we coming with hemostat called gamma. Well, we called it after we come up with this gamma, of course. And it does not cause burn or crystallization. It's biodegradable. It absorbs 70 times more than any existing product right now. And it's also inexpensive. It's also used raw materials, and it's called device just because it's not really drug or cause any issues in the body. It just works on that specific spot to stop the bleed, and doesn't cause a clot for the body. And so we did study, of course, right? And that's the gamma and silex. That's the name of the product that's used in the United States Army in different fields, even in the hospitals. They call it differently, but that's the component, ketosand. And gamma stop bleeding timing. Look at the timing to stop bleeding here, and this one takes longer. But this works right now. And absorption, meaning gamma for same amount, 10 milligram for silex and gamma, our product got much more liquid to that amount, able to take it and hold it than the silex. Meaning you don't have to carry the big bag, larger wound. We have to just have small, and it works. And where it can be used, military, surgical department, ambulance, everywhere. Can be utilized as the pocket, as the larger bags, or it could be as a pistol, all kind of ways. It doesn't matter how. It's a matter of what product you get, how they function. And that's greatly, we got patents as well. And next, probiotics. Have you guys heard acidophilus probiotics? Probiotics, or after you take antibiotics, you get diarrhea, you get side effects, all kind of things, right? So they use something that's take probiotic, take acidophilus, bifidobacter, lactobacillus, all kind of. It's like natural supplements. They're selling it every store you go. 50 billion, 100 billion. Next. So that's a probiotic word. It fights antibiotic resistance, digestive health. That's what they use the most. They use in healthy hair, somebody use for all kind of needs, skin irritation. Now they're applying the probiotic on. It's a pill, it's a powder, it's kind of liquid form, all kind of. If you look it up in the stores, you can notice it says probiotic. So why would we touch probiotic for this point, right? So sometimes it's work, it takes longer, and it doesn't. It's like not always work fast. It's because meaning whatever you need using it for, especially they use for in hospital days or routine life when you have a diarrhea or digestive system. You really want to feel better, and it takes time to get better, and it destroys by the acid system, the gastric environment, and so on and so on, and at times can cause reaction, vice versa, cause bloating and other issues. So it just, we came up with the probiotic, the one exists right now, what you see in the stores. They're not those, they're not spore forming. Spore meaning it's a capsules, has a cover behind it, right? And those spores forming bacteria or that Bacillus coagulans here. There's a 3 or 4, there's not much bacteria form the spores, but since they are covered, for them to work, they work greatly, excellent probiotics group, but to utilize them, you have to wait days. You don't have time for days. You're gonna get lose your, get diarrhea, dehydrated, that nature. So that's why they don't use much in the stores or in the public. Although some companies claiming this, on sale, they're doing all kind of approaches or adjustments to it, but it's not as it's there yet. So we use that probiotic germination spores. It takes up 3-4 days, as I said, right? And especially, it takes time then to get germinated, meaning open up the spores and function. And it delays digestive, metabolic, immune system. You need 4 kind of reasons, but it's too late at times. You need something to work immediately, right on the spot. And that's like showing how the germination goes. You need this process to come up, like one brings up much more helpers for a shorter period of time as possible. That's called germination, right? And that's how the spore goes. When they get the proper environment, they start exploding to division. It's dividing on their own bacteria and do a great job for the body. But it takes too long. And we did studies on this bacteria. We modified it. We came up with a solution how to do it. It's with the technology we used, we took the same Bacillus coagulans, we did some modifications to use them in fermentation process. And we found out, after we test them out, the much better work than exists if you don't do that, if you don't modify them. Even on neutrophils, lymphocytes. Neutrophils is one of those protective cells, right, for the bacterial effect and lymphocytes, antiviral effects. Next, and so classic. They sort of takes, as I mentioned, right? It takes 5 days to work, and hours, 4 or 5 hours. It depends. Everybody is different, condition, but up to 5 hours. Definitely, we really tested out. It works and no side effects. Great response, and it helps not just take care of the problem, also it improves your overall health and immune system and your like energy level. So classic as supplement to treat disease. That's what nowadays they use, right? And nodule, our approach could be used for preventive therapy. It could use as a therapeutic, as if you have a problem, and it could be used in the food industry. You can put in different foods, even like a yogurt even if we try to put in burgers, it's worked too. It stays there. So yes, you can get with different foods. So actually, they're using nowadays this product. It's not doesn't work as proper as they would like to. Next there, and we got a patent. Here we go. And this patented tuberculosis. You guys heard tuberculosis, right? Kind of, it's everywhere because tuberculosis goes all the way beginning of the centuries and being there for a while. and used to giving a lot of hard time to human nature and killing a lot of people until they come up with this vaccine called BCG, right? And they did great job at some point, right? It prevents children from meningitis. A lot of kids used to die, and disseminated miliary, meaning it goes all, like spreads out in the lungs, like the stars on the skies, like all over. And it was a lot of people used to die, but it's not. It did a great job. It's still doing it, but it doesn't work for protection, for initial infection, and when you got the disease, it's not going to work for to treat the disease. Especially, this is latent. Latent when you. I'll show you the difference. Like next, just show me the slide. It's latent when you. I guess I forgot to put the slide. When you get the disease, when you got the, it goes to the lung, right? It goes to your cells. It's called macrophage, and it stays there. Actually, going to be next slide there. Here we go. Now remember it. So this is like somebody coughs, so you get from the air, right? The bacteria right here, and it goes to update to your alveoli. Alveoli is one of those. I would say areas, the last areas in the lungs, in the bronchioles area, alveoli, and they're swallowed by the macrophages to destroy them, right? Bacteria has to be destroyed, and some this it goes to go to body responds to it. Body does job, it does. It destroys some of the bacteria, but some of them goes either you get sick after you get this first contracted. That is there's a for it therapy for it, or you go to the latent. Basically, that was similar, but or you go to the latent, meaning latency, meaning they stuck there in your lungs, in the special in the phagocytes. I'll show it to you. They call it granulomas. That's the word for it. It's right here. Look how it goes. It goes from here. They taking good job here. Macrophages go to phagosome, meaning it's a area when they prepare to destroy the bacteria. Then lysosome is one of the enzymes. Lysis. It destroys, supposed to destroy. So no problem, I will destroy it. It's called phagolysosome. And guess what? Then it's never happens because, I mean, this is natural pattern, how it goes. But in reality, this one stops right here. So it doesn't move nowhere. It's called latent, meaning you're not sick, but you could become sick at any time. So it's kind of like a time bomb, unpredictable. And those people are quite tremendous. You cannot predict how you know who got the TB or not. Anybody knows how we can test it out for tuberculosis? Skin test, right? They do PPD, right? They do skin test, right? They call it MANTU or PPD, and nowadays they do blood test, right? Quantiferon. So, and that's the way it shows either you're exposed to it in the past, or you had a disease, and that's we tested out. It just showed to you as gene modified tuberculosis vaccine, how they created, and this is urease gene right here in the TB bacteria, and it basically saves bacteria not to be destroyed and not to be recognized by our immune system. So to improve this vaccine to work, we need to block this. So we can use actually vaccine to treat it, but not now. They don't have this ability. If we block this here, then we can have so many helpers comes up right here to destroy the bacteria. Here we have just little, but here we could get really stimulate body. Go for it, but not yet. So we coming with our protocol here, finding right target. Again, we ex vivo and in vitro studies. Ex vivo being on the tissue, we've done it, and we came up with this product here, which consists of different components. Again, it's generic, right? And its ability to inhibit that urease, the one I showed you, and let the macrophage phagocytosis complete, so destroys that whatever was latent, already sleeping, ready to go one day, it destroyed that. Next. So we don't have, as a matter of fact, There was a month ago, there was an article from UK, was in the news that they have a tremendous amount of TB coming up because, you know, we always move, right? People say, what's the dirtiest thing carries the infection the most? Money. Because money goes travel around. We don't, how often you wash your hands after you exchange or you touch your face or something, right? So why? Because it travels, you know, lower. The best carrier of the infection. So here's we have immigrations. People move around, right? And so many immigrants came from Asia, from UK, and they have a tremendous problem right now with latent testing because when they come, they're not sick, but this comes up later. And their own people having TB as well, but this all came up really strong. So we came up with this formyl peptide form because of different formulation we use, and it has great response, excellent response on that level, chance to destroy that TB. It is a preliminary conclusion here, high anti-urease activity, that's what we need, we're blocking it, it works. And then we have patent here again, it comes, and it could be already utilized for real. Any questions? Let's go for novel, dynamic, the best in the world, not existing actually in the world. All right, let's go quick here. So, because Dr. Farber already touched base on it. So we have dynamic, trees against leakage effect, right? Nothing works. Becoming dynamic. And let's go next. As meaning slippage, even we use drugs for diabetes, hypertension. We use for all kinds of diseases. How often time we have to increase the dose, right? In clinical field. How often something worked for fever doesn't work now. You have to get another medicine. It happens, right? So this is already, even body itself does slippage, and not bacteria. You tablets for our receptors. And our receptor says, excuse me, why would you bother me to do something? So they change all the time. So that's what dynamic comes to. Not just what I'm gonna say for all kind of fields in the medical. This is what Dr. Farber mentioned to you. Static and dynamic, macro plus micro, we mentioned that too. You can say that, right? And this is the best Swiss knife, better than just the knife, right? Because you have a different keys, right? That's what we want to, that's what we are. Make sense? And go next then. And that's what he mentioned here, right? So this is the way classic bacteria works. This is human body, that's how far they can cover. And that's what's bacteria even smarter than drugs, smarter than body, even the immune system cannot get them. Otherwise we can say we're the kings of the kings, we're not. And we do some job, but not enough. Those guys already override us. That's why we need something, or better be stronger, and for longer. That's what we're coming up to, and we're already here. And that's, and vaccines, and dynamic vaccine, we already predicted are gonna be great, tremendous, because those can be working even for few generations ahead of next. And this is for cancer project we have. We have dynamic cancer project, which is we call FRNA because fractionated. There's the way the protein is structured in the cells. You have the transported RNA, then you have a messenger RNA. Messenger bring the message. The other one transport, the other one constructing. It's like a teamwork. So you want the teamwork for your own cells, not for the cancer. So, and this is fractionated RNA that our company came up with, oligonucleotides. It's basically, it covers most of the carcinoma, adenocarcinomas like prostate, gastrointestinal system, lung cancer, breast cancer, prostate I mentioned, kidney adenocarcinoma. That's most common are adenocarcinomas. And has a high, and the cancer cells has a higher affinity to swallow our product. Normal cells not touching that. It doesn't affect the normal cells. It's only cancer cells. And next slide, let's move on. And what it does, it's adjuvant, meaning it's additional. Nowadays they use chemotherapy, whatever they call it. And chemotherapy sometimes has to be given larger dose. Larger you go, there's a higher risk of side effects rather than benefits, unfortunately. But sometimes they have to win the battle. But in this scenario, we can use chemotherapy, smaller dose, and our product, and it can do great job at the same time. Or you can just use our product, it depends for what problem we're facing to. And this fractionated blocks cancer cell from growing. It increases the tumor sensitivity to chemotherapy, as mentioned, right? Make it more sensitive. If you're more sensitive, why would you give a higher dose? You could use smaller. And you get the same results, even better at times, right? That's what you synergy for. You want to get smaller amount for greater results. And then you have FRNA goes beyond tRNA and mRNA, meaning it's much stronger than any of those approaches nowadays they use. That's what we mentioned there, microRNA they call it. So this is the way tRNA comes here to do to build up the protein and strength in the cancer cells, and let's see what we do. And we go invisible. So, so actually here's the cancerous tRNA, and these parts are what? FRNA. FRNA came and sat on it, and tRNA transporter is stuck. It cannot move. It cannot bring any food to build up the protein in the cancer cell, right? I call it as a target, meaning it's almost like it's all targeting only cancer cells. So this is the kind of more looking at how it works. So we have a fragment mRNA, fragmented RNA, and if you go to see how it moves, this is the way it works usually, and you build up your translated to protein, making protein, and this is FRNA sits on fragmented messenger. I said, no more build up, you blocked. You're under my supervision right here, and it doesn't kill the cancer cells yet. You just stop to grow and see what's going to happen next. And then we give the medication inside the body. This is normal cells, and it's set on the only swallowed or penetrated to the cancer cells. And guess what? Cancer cells are mutating, changing configuration too. They don't love to be killed, right? So you have to do something. And the chemotherapy when they give nowadays, they have to give, some like antibiotics, they have to give 2, 3, and getting side effects or higher dose. And there's a problem as well. So here, you see, some of them catch, some of them went. You see those pieces here? They'll come back. For which one? The one gonna change configuration? That's another keys for them. They're not gone with the wind. They're gonna be working for next flow when you're injecting again. If this changes configuration, we're gonna find you. And it does, okay? Next. And what's happening with them? They don't destroy, they just shrink. You heard that word tumor lysis? So lysis meaning destroy, right? So at times, chemotherapy does a great job, but unfortunately, tumor gets burst, like all the toxins on the tumor spreads out in your bloodstream, and then become treatment-resistant disease, kind of. Because then you have to save person from kidney failure or some issues. It happens. So you want to be stable, but at times you cannot predict as much in the therapy what's going to be the response. In our scenario, the way medication works, it works steadily. First stage, blocking the growth, and tumor shrinks, person feels better, and then you give it again injection. It's like steady injection goes until it destroys the tumor. So this is, it's just, we use the model. It's a Lewis lung carcinoma. We studied on it. It's just one of the examples how we studied. And this is another example of time takes to inoculate to get better. They creating problems as well, because it's unpredictable time they can coming up and causing the problem. And more than 80% adult population, we know that, right? We got this, 1 million in cases of herpes virus, and there's a little statistical what they can cause: cervical cancer, ovarian, breast cancer, lung cancer. It's already kind of statistically was done. And atherosclerosis we mentioned. This is something we're doing currently. It's ongoing project, right? And we're gonna next. It's like one atherosclerosis. Look, that's another coronary heart disease. Same virus right here, similar. Because angina, heart attacks. So we think it's atherosclerosis only, cholesterol only. No, it's so complex. It's not that simple as it sounds. No, not just cholesterol. You see, it's similar viruses causing cardiac, and the cancer cause as well. And this is our like antigen testing down from the patient who died, unfortunately. And basically that's the way they found out with tremendous amount people who has a cardiac events, they had a high level of the certain viruses in their vasculature or the cancer cells, if it would be cancer. So that's what came up with that conclusion, that possibility involvement of the viruses in that pathology. Not as a main cause, but one of the major causing problem. Conclusion. So of these many years of the research and science, atherosclerosis, cancer, and antiviral drugs should be considered at some point to utilize them for that purpose. We're not there yet, but we're definitely looking forward to add our algorithm, that discoveries that we have, an antiviral. Again, you see how we problems we have there, and even the cancer. So those of development definitely could be utilized wide range of problems, even cardiac and the cancer world of disease. You got glasses again for future. You want to see, you want to see how optimistic vision we have for new approach design and synthesis, dynamic and synergistic drugs. No, it just repetition just to know what we went through.
Okay.
Your homework. We just update what we try to, accomplish. We good?
Yes.
Take a deep breath.
Thank you. Any questions at this point?
Any ideas, questions, or something you would like to know about those topics we went through? No questions. All right. You sit a lot. Sure. So this is our basically today's presentations overall of what's happening in the medical field, what opportunities are. Dr. Farber went through different parts of medicine related to musculoskeletal and bone situation problems. But if you touches every of those areas, everywhere the math, physics, geometry, as in like number one, that's like a basic, right, to involve to, and definitely knowing the science and field of medicine as well. So we're good? Any questions so far? All right. So thank you for coming.
Let me add something.
Sure.
Thank you. First of all, did many of you expect to get a book, right?
Yes, you're right.
First of all. So you'll get a book if you have left drive, right? This book's attached all. Second of all, how it works. Since there are many topics, and not all topics we just demonstrate, we just only tip of the iceberg, we have much more topics, right? But in order to avoid intercepting on different areas, right? What does it mean? So better if everybody has different project. It's not a good idea if all of you come to interview said I'll do the same when I taught programmers and everybody had the same project. It's not a good idea, right? You have to be different, remember the beginning. So that's why think about this and choose, for instance, 3 of these examples and make these priorities. And you have our email, and our team based on this choose to
How to match you
to
guys?
match or to how to make not the same projects for this different people, to make like unique, distinct project, I would name it, right? It's better. Think about IT. Some student ask about this. You also can implement your
Knowledge.
knowledge,
Mhm.
and from this case you will get references not only from us, also from European Academy of Science, Germany, right, which is also good, like or work overseas in this case. And plus one slide I would show, very important, I forget to tell you, if you show this viruses slide, can you return to virus?
Put them on the circles.
No,
No.
where is graph?
Graph.
So for a second, if you can do this, graph viruses.
Oh, the
Can you turn off lights just a second? This is also extremely important slide, right? Look at this, what we have in the glasses. Okay, oh, there it is. Jet?
so,
Thank you. Oh, here it is. This is our technology, right? A level of oscillations. If you look at this, it goes from 0 and increasing in x-axis. And this is efficiency, let me put this vaccine, simple way, right? Coordinates. Now look at this. What is it? A 0 level of oscillation. Level of oscillation is 0. It means it's not oscillated. So this regular vaccine. Regular. You take the same vaccine and look at this. The SAT student. This about what is it? 1,000. 1,000.
titers.
This one, this
Yeah.
level, right? Over
Mhm.
this. So this is a regular vaccine. Now we apply our technology for the same vaccine. And now when we have a level of oscillation about 3, look at this, what happens. You see this jump? The same vaccine. It means we can apply less amount, tremendously less, in a greater zone. It's like miracle. We work with this a lot, and this slide extremely informative. You see this? The same vaccine. So we have tools which help, even using, like Dr. Kleyn emphasized, using generic repurposing drugs. You can make this absolutely different way. If you look from different side, different combination and use synergy and apply new technologies. This I want to mention this. One more thing about return to our projects. When you have this is everything is novel here. You won't find anywhere when you get in Google how to get to Manhattan. You have tons of this, right? Or is a mere tons of this. But in this particular case, nothing. It's only what we have here. It is good because it's absolutely new. But it is bad if you want to make a project. Because usually when you make analysis, right, you have a lot of different sources.
Nothing to find.
And we don't have too much sources, right? If you don't expect that we give because we don't have it. If you take some particular project, you have to fight with information. You will take patents, what we have. We share what we have. Okay? We never share with know-how with nobody, even patents. You know this. Okay? I started doing patent from 11 years old all my life. And we know what is know-how. But whatever we have, we share, but we don't have too much. That's we have comparable analysis, what we have in the market, probably this structure, and what we have of this. I tell you honestly at the beginning, because you don't expect too much help from us. We only have what we have. It's the second one. The third of all, how we communicate, how it works. You take specific topics, for instance, you decided you take or not. After that, send us email with your topics, right? And you thought about this. Actually, we don't need too much your ideas for now. We want to help you. This is our goal. And after that, when we compare all this database, small database, because there's not too many students here, right, for now, which we make priority based on you. You put 1, 2, 3 based on a range of priorities, right, Dr. Kleyn?
Right. Because we have to
And
see how
after
many
that,
applied for this project.
when we discuss, you work by yourself. Where you're supposed to work? You will work from home, from your computer, not necessarily to travel every time, right? And when it's ready, you have specific questions. It's not necessarily we in contact every day. It's unreal, honestly, right? Okay, usually we see here, and when you finish your project, or maybe in the middle if you have some questions. Next time, Dr. Kleyn.
No.
Yes?
It depends, right? Project to project.
Project to
Right.
project, that's it.
Some of
And
them is
based on
those-
our observation, how it works. I give a couple examples. I know you're tired a little bit, right? If you would like a couple examples how it works. Many times we do not necessarily give our project. For instance, one student came to us a while ago, and he wanted to be in radiophysics to create something like this, which is not in scope of this presentation, right? But since all my life I try to contact different theories and different people, and I met one person. He is a Lev Terman, legend who worked with many scientists. He created company, and I give him. If you Google, you can find Terman works after this. I give this project. I said, very interesting. Just try to improve this Terman works. He got it. He got to MIT for this project. It was, you know what the Terman box was? When you have, let's say, contour or some radio device and you put your hand and the sound changes, right? Because capacity of this inductivity changes, right? And Terman created this device to, when you use hands, you change capacity of the space. And he created a company in the United States of this. So he made this device. He was accepted to MIT with all these projects. Think about it, okay? And some people get to Harvard with cardiosurgery after this kind of our work, like another Patrick get also to cardiosurgery, another go to immunology, etc. Says thousands of them. So it's not only project for paper. Maybe you think, because some people wasting time. Time is very important. If you have impressive presentation of Steve Jobs, he said every minute is important for your life. If you really think about this, you can create a lot, right? And maybe it give you boost in future. And in future, who knows? You head of lab, and we contact after this in different collaboration in this case, right? Think about it. This is our cup of tea. Well. So now, Dr. Kleyn, how to make a copy? Because I have in my flash drive all these books.
Right. So who has the memories?
You have memory stick?
Yeah.
Can we turn it on? Okay.
Where's the book?
This is flash drive.
Let me just.
It's written. I'll show you books. On this cover. Book's big. It's not like 25 meg, right? When you send by a regular email, you can use all this different stuff.
Okay, Schuler books, right?
Also books, right?
Just only this profile, right?
This.
No.
And we have 4 books. One of them,
Yeah,
How to be
it's
genius in Russian. But anyway, you can scan, convert to PDF, convert to Word, and translate it if you need it. So both parents will be somebody. But this is nice one, right? If you'd like to see how it looks like, I can go with this. You can do this. If you'd like to see this on a device.
That's fine.
Yeah, sure. This is the first in the world we use idea of rational mechanisms. Our mechanism self-adjusted like this dynamic drugs. If you make it not stable, because of this pivot, it changes configuration and becomes always stable. Self-adjusted is the first in the world self-adjusted mechanism based on, be careful, it's a little bit like, you know this, yes.
Yeah.
But you have napkin, right? A German company created a new device for machinery, huge one. And professor look at this, Dr. Reshetov, and 5 minutes it's not good by his formulas. It's like miracle when you have these formulas. When you look at this, nobody knows.
Yeah.
They spend years, top level engineers. 5 minutes.
That's crazy.
Можно переписать сюда его.
Да, I gotta get to the computer first.
Computer, да.
To let you
А с
use your,
компьютера просто перепишешь.
use your effort. That's what I was thinking.
And definitely when you finish this, we ask you some question about trees, students. I'm not giving book to put in on the shelves, right? You ask how you understand this. And I was director of science, biggest institute in Moscow, right? And people to get to this job, they have to pass some trees interview. As a result, I got the best team in the world. I prepared them. Study trees, you will have a lot of fun. Start from this one. Easier one,
Oh, yes, we can.
translation. And suddenly inventory repair. This is easy a little bit, right?
If we don't have a USB, do we just get the, how do we get the book? Do we just purchase it?
Not good idea, they're pretty expensive. Why supposed to spend $300 for one book? Only one
Oh.
300. So who would like to send rest of you by email? Somebody ready? If you can change with somebody, who will get right now, and you can send rest of your friends by email. Will somebody ready to do this?
I can do it.
Okay, good. So give your email. Give your email. Somebody, right? You have flash drive right now?
Yeah.
Right. You have? Yes. Okay, good. Excellent.
No.
You see, system becomes works, right? Why do we name all these drugs NGL? Anybody ideas? Any ideas? Tricky question. Why we name NGL 025, 22?
It's after the company.
No, Nigel.
Yeah, right.
Yeah, absolutely easy. That's why we name it NGL.
But this is someone else. Where's also this?
If I recommend some books to read, this is one of the most important books. My
I
point.
see what's going on. What if there's someone else?
Another book, I don't have it
That's
here,
yours, right?
but Daniel Granin, there is a book about Lubishev. If you know this book,
I'll try it from my computer.
это странная жизнь. He
Strange
wrote,
life.
you can download it for free from internet in Russian. And Professor Lubishev, what he did, he wrote how he spent every minute of his life. He washed hands, he wrote, wash hands, 1 minute. At evening, he count all these minutes. And he wrote how many minutes he count all these minutes. And he found that everybody wasting time for free, but wasting for nothing. And he said, I don't understand when somebody said, I don't have time to visit parents, or to write email, or contact friends. He found that everybody has a lot of time they don't use properly. For instance, chatting. Okay? Time is very important. So think about it. If you have any question before Dr. Kleyn will write it, please start. You're lucky there is no Dr. Martinov, because it would be less than 2 hours.
We eliminate him.
No. We try to
No, he's
squeeze,
busy.
actually, this quiz, it's not everything here. only these drugs we have about 30 different positions. You saw just fine. There is expression if you like to, if you like your profession, you work only one day in your life. You know this expression? It's true. Because the rest day you have fun, right? Start from suddenly inventor, this one.
Steven.
Plus, you can see on Facebook and
Yeah, I
YouTube.
got yours. Take a look. Like Steven again.
You do exchange
I'll try
emails.
to make it.
It's everybody exchange.
Um,
So many of my, some of my presentation on trees you can find in Facebook, Farber Center, and YouTube Farber Center. In more congresses, etc., in different languages, Russian and English. Look at this, you'll get more information. By the way, you can find some ideas also from this presentation, which not included here. Dr. Kleyn, what do you think?
Yeah.
We have presentation with Dr. Kleyn on these congresses, and some of this not included in this one.
You have on YouTube some.
YouTube
Right?
and Facebook, 4%.
Oh, your
right?
Facebook, right.
In both. So you find something of this, welcome. Maybe it would be lucrative for you. Make sense?
I'm not sure if I took down all the ideas. Is it possible to go back to the slides so I can finish writing them down because I want to see my options?
You
Picture.
have many slides over there. You have this
Be
presentation
on YouTube.
on YouTube.
Yeah.
Okay. So
In few days, right?
Okay, alright.
Plus, if you want to go in depth of this, you can find our different presentation in YouTube and Facebook. Okay? Because some is trees in education, some trees in medicine, or etc. Do you have Flash? My suggestion: exchange your information with Brian, right? With Steven.
Okay.
You already did it or not?
Oh, no. No,
Yeah.
I'll give him
And
one.
he will send you by email.
Perfect. Thank you so much. Thanks.
Доктор Фабер, это должна быть индивидуальная работа или они могут объединяться в группу и
Нет,
быть
лучше
проект?
в отдельности.
Индивидуально.
Better to do it separately, right? Make sense? Pretend you go to the same university and you have to be different, right? Make sense of this? In future, you can collaborate when
Where's my laptop? Is there? My laptop.
I don't know where it is.
It's not up there.
there is
I'll
a
look
picture.
for it.
check the
I'll
room.
look, yeah.
I cannot get this. It's recognizes.
It should be in here.
My laptop. Oh yeah, thank you. Thank you.
Good.
It's formal now. Dr. Farber, we got those sign-in sheets from everybody, right? I don't know, I have to check, because I was busy with it.
Oh, by the way, students, did you bring parents' consent? It's must,
Yes,
right?
it's collected.
It's collected, right?
Mhm.
It's up
Without
front,
this, we
right up
cannot
front
start.
desk there.
Yeah, and they
Yeah, you have,
scanned it,
you have
yeah.
them all?
Excellent.
Yeah, okay, just make sure, because we have to put on the file.
You should share with parents everything that we did here. It's not secret. Parents, your friends, right? It's not like school. Keep in silence everything. No way. Share this and take support from this. Ryan, what college you are right now?
I graduated actually.
Graduated?
Yeah, Binghamton.
Okay, and what is your plan for next day?
In approximately 3 weeks, I start medical school.
Oh, excellent.
Thank you.
Congratulations.
So,
I
just
love
wanted-
medical school.
Okay,
no.
applaud.
NYIT. Yeah, thank you.
Congrats, seriously.
Oh, it's Nikon.
Nikon, yeah, yes.
My kids graduated.
Oh, really? Nice,
Good
nice.
luck.
Thank you. So I just wanted to
You.
stop by and say, introduce myself.
Awesome.
It's a pleasure to see former students,
Yeah,
right?
absolutely.
Always.
Absolutely.
Remember you were a small kid at the beginning.
Yes.
Everyone was small. My kids went through your school too.
Yeah, I remember,
That's what we met.
Do you know what specialty you work in?
No.
No idea.
No, they just go straight, like just general.
I know that's a good question.
How fun this guy. Sharon, your turn. Come on.
I'm in Toro University. I'm a PA student. I have one more year left. I'm in my rotating clinical phase, and I'm rotating at
Geriatric, all kind of stuff.
Yeah.
And
Yeah, I'm Jacqueline. I'm a PA student. I also go to Toro. We both one more year clinical yet left, but yeah, then we're free after that. Yeah.
Not total free, but
Yeah, half free, a little
Time.
free.
Instead of doing nothing,
Yeah.
whatever.
Then we'll do everything.
what are your plans for future?
I go back and forth a lot. I do really like family medicine. Like I like following up with my patients, and like long-term care is great because you get to like deal with their chronic diseases and like maintain them, you know. I like having a relationship with my patients, so I'm looking forward to a primary care thing, something like that.
And your plan for future?
I'm stuck between two. I really like emergency medicine. I think after graduating, I want to do a field of medicine where I see different things, different patients from different populations, and I don't want to go to like one scope of medicine and just forget everything else that I've learned. So I think emergency medicine is a good foundation where then I can spread out and do something more specialized and have a good
Because
background.
more hands-on, right? You expose so much,
Yeah.
right? at
Yeah,
once.
especially
Yeah.
after graduating.
That's true.
Makes sense.
Very good.
Otherwise, I'm thinking dermatology, which would be a niche, but yeah,
So very
But
good.
very
you will see.
competitive.
But every time something unpredictable, you plan for
True.
one way around, but it's medicine, so many
Yeah.
opportunities.
I wanted
Like any
emergency
specialty you have,
so long. but-
in computer science and
Do you plan in future to participate in PhD program?
I know they're initiating that for PAs now. That's something I would think about in the future.
We might have no choice at some point.
Yeah, that's true. But it's cool
But
having
yeah.
that research in with the career. Yeah.
I did research when I was in high school, and it helped. Like it
really
looks
does.
good on your resume. Like
Yeah.
I graduated high school and I had 2 publications.
That's awesome.
Yeah, so it would help.
The research is really good.
So I'm talking not only about publication, but also a PhD, philosophy doctor, this degree.
I mean, right now I'm just trying to graduate PA school.
I know.
And then I'll see what
You're
happens.
looking in the future, long run, right?
Yeah.
Definitely. Yeah. Something to think about. Yeah. You guys?
I'm Gabrielle. I'm in Mercy College PA program, and I'm in my clinical year, so I have 1 year left.
Mhm. And what is your plan for future?
I still have a year left of rotations, but I really like neurology, so maybe think about going into neurology. We'll see.
Very good. By the way, students, okay.
We're still students.
We have in this oldest institute in Europe, immunology, right? We have a magazine, our magazine.
What's it called?
I show some magazine of Institute of Immunology, right?
Okay.
This one.
Mm.
And keep in mind that if you work on this, right, and you write something nice, I can guarantee, but it's possible that it's much easier to publish because I'm a member of this magazine, right? And I can help you to make publication of this. It's related to the. Keep in mind, not 100% because I want to see what is it. They supposed people check of this, but it's nice option.
Yeah.
Because we publish in some magazine Q1, Q2, you know this classification, right?
Sounds good.
Top magazines, right?
Okay. Yeah.
The classification.
Mm.
But sometimes if you need, for instance, we have publication for AI, artificial intelligence, right? In this case, it was much faster. In order to waste on this line, we publish all this, and you can find these couple articles on AI. We have been working on AI many years, for 30 years, 40 years. So you also can publish on this. So keep in touch with us, right?
Mm-hmm.
No, Dr. Kleyn definitely,
Yeah. Thank
and
you.
we'll be on the same team, and it can help you a
Yeah,
lot.
great to know. Thank you. Yeah.
When you go somewhere, you have publication, is a different story.
Right.
100%?
100%.
Yes. But otherwise, how to do this thing somehow? Nothing, right? This is also good. What are you waiting for, Dr. Kleyn?
I think he has a flash drive on him. I think he's
Oh, I
hoping
see.
that maybe mystery maybe.
So you have, since anyway we here, you have questions, ask, I will answer questions.
There you go. Can you imagine? That's not flashback to the date. Gonna get Steven then. We're gonna be sharing.
Oh, you need. Okay.
Will work.
Doesn't
Like
work?
almost like my
Like
projector.
everything.
Oh, you should have
Everything.
try that.
Be careful
She did.
because
Let me
She
move
goes
over.
to her, she
Move
wants.
over.
you know how we'll take the file
Certain
because
medications.
we'll might
I
now
have
that
an idea.
shoot.
Yeah.
Oh,
I mean,
wait.
I did.
Yeah.
I have a few ideas for different research projects. Some that I did. There's one that I'm doing right now on microglia and
What?
neurodegenerative diseases.
So much
and how
sweat.
to-
Yeah, so that's a question for
Long story
Dr.
short,
Kleyn. How big
some
a
of you guys
trial?
do. I want to see. I want to go further than like
Setting, right?
implementation.
I just realized
I
that.
want
Oh, yeah.
to see if like
We'll
the
try
body
such a
talks
thing,
about it. But we
guys
have to
torture or
ask
what?
for what we're
No,
listing as
I-
our priorities for what we're
What?
researching. We have to talk
What?
about whether it's interpretation or if we like put in
Yeah.
This
what
guy
like,
cannot
we
fall
were
asleep
thinking.
Yeah,
because
so
they're
You
wrong.
can also think all your thoughts, what you would like to do in this case, right?
Okay.
If it's our scope, you don't mind.
How big
doing
is the
it, right?
file?
You're supposed
'Cause I
to
can't
think,
share
because
files
whatever
with
you said, I
25
don't have
megabytes.
idea right now. More specifically, what
You want to give you sizes?
Yeah.
Actually, you can go by
Yeah,
Google Drive.
Yeah.
Oh, okay.
Oh,
I'll just do it by
You know,
Google Drive.
if you, yeah, Google Drive, 100%, yes,
Yeah.
yes.
Everybody has our
Google Drive
email,
can
right?
take so much.
Farber's,
I'll do that.
Farber Academy.
Farber Academy 1. Everybody has, right?
Harvard 21.
So this, they also have email, or they have your email?
No, your email,
I
because
talking
you send
about-
it. No, they don't have it.
We gave her emails.
I
Yeah.
give, did I send you email? I forward to you that invitation,
Yeah.
and you send them, there's a Farber Academy.
So
email.
choose topics.
Farber
and send
Academy
to
1.
Farber Academy 1, right?
Farber Academy 1 on that email. Can you open it?
Let me get my phone.
Okay, it's your phone.
Because we want to concentrate in one place everything, right? If you have question, we have team view, look and so. So wherever you have, think about it.
So, on your way.